The aim of this video is to demonstrate the practical procedure of aseptic peripheral venipuncture for the purpose of blood cultures. It will show the equipment required and a run-through of the procedure itself in real time. Firstly, the equipment necessary is displayed. Apron, sterile gloves, sterile pack, chlorhexidine cleaning sponge, 20 ml syringe, 3 18 gauge needles, blood culture bottles, alcohol swabs. A trolley to place the equipment close to the patient is also essential. Put on the plastic apron, remove all jewellery from your hands and ensure your arms are bare to the elbows. Then, without touching the inner surface of the sterile pack, open it out onto the top of the trolley. Thereafter, place the sterile gloves, chlorhexidine cleaning sponge, syringes and needles onto the sterile pack surface, again taking care not to touch any of the items themselves. Place the tourniquet onto the patient's arm and palpate the vein you plan to venipuncture. This is to reassure yourself of its location. Next, it is important to wash your hands and arms to the elbows with antiseptic solution. Dry your hands and arms with a sterile towel. Again, taking care not to touch any other items, open the sterile gloves and put them on in a no-touch technique, ensuring the hand surface remains sterile. Prepare the patient's skin by carefully cleaning the area, initially starting over the vein and working your way peripherally. Allow the chlorhexidine to dry. If a chlorhexidine sponge is not available, then apply appropriate antiseptics to the skin as available in your ward. Taking the 20 ml syringe, connect one of the needles and again, taking care not to touch the needle, venipuncture your chosen vein without touching the now sterile area of skin. Ideally, you should venisect 20 ml of blood in total. This gives 10 ml per blood culture bottle. The minimum is 10 ml in total, giving 5 ml per bottle. This is required for the test to be sensitive in the labs. At this point, loosen the tourniquet and place a swab over the venipuncture site as you withdraw the needle and apply pressure. Prepare the blood culture bottles by removing the lids and cleaning with the alcohol swabs. Allow the alcohol to dry. Next, it is important to place the sample into the bottles as soon as possible. Again, this relies on a no-touch technique. Carefully remove the needle used for venipuncture and replace with a new clean needle. Puncture the first bottle. This has a vacuum and should aspirate the blood from the syringe directly. Once 10 ml has been placed in the first bottle, remove the syringe and again replace the old needle with a third clean needle in a no-touch technique. Taking great care, puncture the second bottle and the vacuum will aspirate the blood from the syringe. Ensure all contaminated sharps are carefully disposed of in an appropriate sharps container. Dispose of the rest of the equipment into a clinical waste bin. Label the bottles. If sampling from different sites, it is useful to label the site on the form and the bottle. Give as much clinical information as possible. This improves interpretation of any positive result. If the bottles have got barcodes on them, please do not remove the barcodes from the bottles, as these are used in the lab. Ensure the sample is transported as soon as possible to the laboratory or place in an incubator until the sample can be moved to the lab for processing. Do not place the specimens in a fridge. Do not forget to record in the case record that blood cultures have been taken.